Imagine a child who used to love playing outside, suddenly losing interest in their favorite activities. They seem tired all the time, withdrawn, and uninterested in spending time with friends or family. Maybe they have become unusually irritable, crying over small things or lashing out in frustration. Now imagine that these changes last not just for a few days, but for weeks or even months. This is not just a bad mood, it could be childhood depression, a serious but often overlooked mental health condition. For a long time, people believed that children could not experience depression, assuming that childhood was a naturally happy time. But research has shattered this myth. The American Academy of Child and Adolescent Psychiatry estimates that up to 3% of children and 8% of adolescents suffer from depression. Even more concerning, depression in childhood often goes undiagnosed because the symptoms do not always look the same as in adults. While adults with depression may express sadness or hopelessness, children often show it through irritability, social withdrawal, difficulty concentrating, or physical complaints like headaches and stomach aches. One of the first major studies on childhood depression was conducted by Dr. Robert L. Spitzer and colleagues in the 1980s. They found that children as young as 6 could meet the clinical criteria for major depressive disorder. Since then, research has confirmed that depression is not just an adult problem, it's a real and serious condition that can impact a child's academic performance, social relationships, and even brain development. Depression in children does not always appear alone. It frequently coexists with other disorders like anxiety, ADHD, or conduct disorders. Some children develop persistent depressive disorder dysthymia, a milder but long-lasting form of depression that can last for years, affecting their ability to experience joy or excitement. Others might experience bipolar disorder, where depressive episodes are followed by periods of extreme energy and impulsive behavior. What causes childhood depression? Like most mental health conditions, it's a combination of genetics, brain chemistry, and environment. Studies have shown that children with a parent who has depression are 2 to 4 times more likely to develop it themselves, suggesting a strong hereditary component. But environment matters too. Stressful life events such as parental divorce, bullying, abuse, or even academic pressure can trigger or worsen depression. Brain imaging studies have provided fascinating insights into how depression affects children's brains. Research has found that children with depression often have an overactive amygdala, the part of the brain that processes emotions, and reduced activity in the prefrontal cortex, responsible for decision-making and emotional regulation. This explains why they might struggle with emotional control, experience overwhelming sadness, or feel hopeless even in positive situations. Early detection is critical, but diagnosing childhood depression is challenging because symptoms can mimic normal developmental changes. A child going through a rough phase might temporarily lose interest in activities or struggle with mood swings, but clinical depression is persistent. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, for a diagnosis of major depressive disorder, symptoms must last at least 2 weeks and cause significant distress in daily life. Psychologists and psychiatrists use various assessment tools to diagnose depression in children. The Children's Depression Inventory is one of the most commonly used questionnaires, helping identify emotional and behavioral symptoms of depression. Structured interviews with the child, parents, and teachers also play a crucial role in understanding the full picture. But what happens after diagnosis? Fortunately, depression is treatable, and early intervention makes a huge difference. One of the most effective treatments is cognitive behavioral therapy, which helps children identify and challenge negative thought patterns. A classic example is a child who believes, "Nobody likes me." CBT helps them reframe that belief by exploring evidence to the contrary and practicing social skills. In some cases, medication is necessary, especially for moderate to severe depression. Selective serotonin reuptake inhibitors, like fluoxetine, are the only FDA-approved antidepressants for children. Studies have shown that when combined with therapy, SSRIs can significantly reduce depressive symptoms. However, they must be prescribed carefully, as some children experience side effects or an initial worsening of symptoms. A famous case that brought attention to childhood depression was that of Brandon, an 11-year-old boy who had always been outgoing and cheerful. Over time, he became withdrawn, stopped playing sports, and started complaining of frequent headaches. His parents initially thought he was just being lazy or going through a phase. But after speaking with a school counselor, they discovered that Brandon had been struggling with feelings of worthlessness and sadness for months. With therapy and support, he gradually regained his confidence and energy. Stories like Brandon's highlight the importance of recognizing early warning signs and taking action before depression worsens. Perhaps one of the most heartbreaking aspects of childhood depression is its link to suicidal thoughts and behaviors. Suicide is the second leading cause of death among adolescents, and while rare in younger children, it's a growing concern. A study published in JAMA Pediatrics found that suicide rates among children aged 5-11 have been increasing, making it essential to address mental health early. Warning signs include talking about death, giving away possessions, sudden changes in mood, or engaging in risky behaviors. So, what can parents, teachers, and mental health professionals do? One of the most powerful tools is early intervention and open conversations. Instead of dismissing a child's sadness as just a phase, we need to validate their emotions and provide support. Studies show that strong social connections, a stable routine, regular physical activity, and mindfulness exercises can all reduce depression symptoms. Schools are also playing a bigger role, with many implementing mental health programs to teach children coping strategies. As Dr. Martin Seligman, the father of positive psychology, once said, "Children learn resilience when they experience setbacks and discover that they can overcome them." With the right support, therapy, and sometimes medication, children with depression can recover and go on to lead healthy, fulfilling lives.